Hello guys, welcome to Homeo Health Care. Today we are going to discuss on the topic Quinsy. So, what is it? It is an accumulation of pus in the peritonsillar space is termed as Quinsy. So, what is the peritonsillar space? It is this space lies between the anterior pillar and the posterior pillar of the tonsils. The another term for the quinsy is peritonsillar abscess, as abscess means accumulation of pus. So, this condition is mostly unilateral. Either the right side get affected or left side get affected. At the same time, both sides will not get affected in quinsy, only either left or right. Then, what about its types? It has four types: anterior presentation, posterior presentation, lingual, and tonsillar quinsy. What is anterior presentation? When the accumulation of pus tends or it is more towards the anterior pillar, then it is termed as anterior presentation. And this is the most common condition that has been seen out of these four types. The second type, posterior presentation. In this condition, this accumulation of the pus or this abscess pushes the tonsils forward. Then, what about lingual quinsy, where it gets affected? In lingual quinsy, lower pole of the tonsils gets affected. Then, what about tonsillar quinsy? When the quinsy is within the tonsils, it is tonsillar quinsy. As quinsy means the accumulation of pus. So, when this pus gets accumulated in the tonsils itself, it is termed as tonsillar quinsy. What about its pathogenesis? When the mouth of the tonsils get fibrosed due to the recurrent attack of tonsillitis. As in the earlier video, we had discussed that quinsing is one of the complications of the tonsillitis. So, when the recurrent attack of tonsillitis gets to the patient, the mouth of tonsils get fibrosed. And after this fibrosis and edematous condition, this mouth get stenosed. That means stenosis of the mouth. Due to which, what happens further? The accumulated pus breaks the capsule of the tonsils. Our human tonsils has capsules. These capsules gets break by this accumulated pus and leads to the condition of peritonsillar cellulitis. Now, after that, when this condition has come of the peritonsillar cellulitis, it leads to the peritonsillar abscess. And what is the another term for peritonsillar abscess? Quinsy. So, this is the pathogenesis for the quinsy. Then, what about its clinical features? What symptoms the patient of quinsy gives? There will be pain in the throat. The intensity will be more. severity of pain is well marked in the throat. And what type of pain it is? It is a radiating type of pain and it radiates to the ear. गले से कान तक ये दर्द जाता है और दर्द बहुत ज्यादा होता आहे. त्याच्यामुळे पेशंटला खूप त्रास होतो. तो त्रास त्याला सहन होत नाही इतका त्याला तिथे दुखणं असते. Again, when does it gets aggravated? What is the aggravating modality for this pain? Swallowing. When patient swallow some things, the pain gets aggravated. Trismus. What does it mean? There will be difficulty in the opening of the mouth to such patients. He or she may suffer in difficulty to the open his mouth. And there will be the painful opening of mouth. When the patient opens his mouth, the pain will be more. Without pain, experiencing the pain, he can't open his mouth. There will also odynophagia. What does it mean? That means difficulty in swallowing. When patient swallows something, it is painful. This condition is so much marked in the patient that even he or she cannot swallow their own saliva. And the salivation process gets hastened in this condition. The production of saliva increases in this condition. Then, what another things you can see? Halitosis, foul odor from the mouth. That can be also seen in Quinsy. Along with that, what can be there? Fever. What type of fever will be? High grade fever. The temperature may rise to the 104 degree of such patients. Then malaise, body ache, weakness will be there in such condition. And as the high grade fever is there, the pulse rate of such patients will be also more. When you examine the pulse of such patients, it will be more and more. It will not in normal range. As with every 1 degree of rise in fever, there will be the increase in 10 beats of the pulse. And when you examine this patient, what conditions you will see? These tonsillar pillars and the soft palate in the mouth will be congested and swollen. What does this congested mean? That means the congestion process has taken place. In that, there will be the redness. When you inspection process is done, the redness in the soft palate and the tonsillar pillars will be there. And this is due to the accumulation of blood. When blood gets accumulated, the redness is more present, and this process is known as congestion. And what can be seen? The tonsils may not appear. Why these tonsils will not appear? Because it gets buried due to this swelling and accumulation of pus. That's why it will not appear. Then, what other things you will see? The uvula is present. It will be swollen. It will be edematous. And the position of uvula will get changed. What the normal position, it will not be there. That things will be there. Swollen uvula, edematous uvula. Also, bulging of soft palate will also be there along with the swollen uvula. What other examinations finding will be there? When you palpate these cervical lymph nodes, it will be palpable. That is cervical lymphadenopathy. This condition will also be seen in condition of Quinsy. Mostly, the jugulo-digastric lymph node is palpable. When you palpate here, then the lymph nodes will get palpate. And the torticollis condition will also be there. A patient will keep his neck tilted towards his side affection. If left side gets affected, he will tilt his head, neck to the left side. If right, then on the right side. Such things will be seen. What complications get if it remains untreated? Parapharyngeal abscess, there can be septicemia, edema of the larynx, hemorrhage condition can be there. Such complications will occur if the quinsy remains untreated. Now, what about its treatment? In homeopathy, after taking a detailed case, what remedy suits to the patient? After administering that medicine, after the duration of course of treatment, it gets healed. The condition will get disappear. जब होम्योपैथिक मेडिसिन उसे एडमिनिस्टर की जाती है कोई पेशेंट को, जब उसकी डिटेल केस लेते हैं, उसका एनालिसिस करेंगे, केस प्रोसेसिंग करेंगे, कौन सी दवा ऊपर निकल के आती है, वो दवा देने के बाद जब उसे अच्छे से आराम गिरता है, जब वो कोर्स ऑफ ट्रीटमेंट कंप्लीट होता है, जेव्हा पेशंटला त्रास असतो तो एका डॉक्टरांकडे गेलो, होमिओपॅथिक डॉक्टरांकडे, होमिओपॅथिक फिजिशियनकडे आला, त्याची डिटेल केस टेकिंग झालं, केस प्रोसेसिंग अनालिसिस झालं व्यवस्थित, कोणतं औषध वर निघून आलं जे त्या पेशंटला चांगल्यानं लागलं आणि त्याचा त्रास निघून जाईल एका पर्टिक्युलर कोर्स ऑफ ट्रीटमेंट नंतर. As we say, we treat the man in disease, not only the disease in man. त्रासामध्ये आलेल्या व्यक्तीला चांगलं औषध काढून देण्यात येतं रादर दॅन फक्त त्याला जो त्रास आहे त्याच्यासाठी औषध देण्याऐवजी. So, if you like this video, subscribe to my channel. Thank you.